Hello, everyone. My name is Jordan Reeves, and for my project, I'm going to be doing the association of hypertension and renal cell carcinoma. So, for background information, this is the most common type of kidney cancer. It's fairly newly researched. So most data only goes back to 1990. So there's not a ton of case studies on it, but there is enough for the project. A heterogeneous group of cancers that arise from renal cell tubular epithelial cells. They encompass 85% of all primary renal neoplasms. These direct substances that your body needs, so water or nutrients, to the bloodstream while also filtering waste through urine. They usually occur between the ages of 60 to 80 years old, but there are some instances when people develop cancer much sooner in life. So if they have several of the risk factors a lot earlier in life, then they can develop the disease a lot sooner than this age range. Incidence rates vary amongst different countries and regions around the world. And I found that higher developed countries tend to have higher incidence rates, which is typically not as common for certain diseases. So global surveillance of renal cell carcinoma, the Global Cancer Observatory provided a lot of information for the specific disease. Incidence rates increased from 207.31 times 10 to the third in 1990 to 393.04 times 10 to the third in 2007. The United States and China have the highest incidence rates of the disease. And regionally speaking, Western Europe has the highest incidence rates internationally, which you'll see on a table. It's a lot higher than other regions around the world. And incidence rates are also higher in high sociodemographic degrees and also in males. In these two specific categories, that was common amongst all regions around the world. So this picture just shows the United States and China are the highest countries or have the highest incidence rates. And this was just looking at the countries, not necessarily the regions. So on this table, this is part 1 of 2. East Asia has the highest incidence rate of 52.29. And that makes sense because China has higher incidence rates. And then on the next slide, you have high income North America, right? So the United States is in that category with 68.84. And then Western Europe beats all of the regions with 72.67. So not necessarily each individual Western Europe country has these high incidence rates, but all of them together outrank all the regions in the world. So national surveillance of renal cell carcinoma. There's a couple systems in the United States for this disease, and they are used to identify and analyze recurrences of renal cell carcinoma. So these systems include National Comprehensive Cancer Network and the American Urological Association. So I found a source that dealt with incidents and incident-based mortality rates in various states. So it wasn't all 50 states, but there was a few. Alaska had the highest incidence rate of 20.45, and then incidence mortality rate of 12.603. All the other states had relatively similar rates, and they all worked together, but Alaska was the outlier here, which I found really interesting. So for state surveillance systems in Texas, there's really not much data for renal cell carcinoma, but Texas Oncology provides a lot of information for patients that have the disease. So they explain the different stages, so 1, 2, 3, 4, all the way up to the metastatic level. Talk about prognosis, diagnosis, and different levels of treatment to really ease the anxiety about this disease because it is so new. So that is very helpful. Hopefully the state works towards having more surveillance systems because it is pretty prominent in the United States. So for route of transmission, there is not really a specific route of transmission that I found. With any type of cancer, it's a buildup of other things. So it could be several risk factors that I mentioned later. There's not just one clear thing that causes it. So I want to look at how it's spread within the body. So grows in nearby tissues, passes through the walls of nearby blood vessels or lymph nodes, moves through the bloodstream and lymphatic system to other areas of the body. Once it moves to other areas of the body, that's when it becomes metastatic stage 4. Renal cell carcinoma grows in small blood vessels and then the walls of those blood vessels. And then when it becomes stage 4, is once it's invading in the tissue to form metastatic tumors. So that's when it becomes really serious and your survival rates are much lower. Diagnostic testing for renal cell carcinoma. There's common and uncommon forms of testing. So common forms of testing include blood and urine testing, image testing, so ultrasound, X-ray, CT, or MRI. Those are more common. Those are routine. And then biopsy would be kind of a less routine, but still pretty common, to test the kidney tissue. So you have percutaneous kidney biopsy or open biopsy. And then an uncommon form would be genetic testing. So BRCA genetic testing and cancer genetic testing are the 2 forms that I found, and they have really helped in learning about this disease and treatment advancements and so forth. So treatment of renal cell carcinoma, there's a surgical treatment option, non-surgical, and then for more advanced cases, there's other instances. So for surgical treatment options, we have a nephrectomy and partial nephrectomy. A full nephrectomy would be removing the kidney, and then a partial nephrectomy would just be removing the tumor from the affected kidney, so removing that tissue that has been invaded with the tumor. And the non-surgical treatments that are a little bit less invasive would be cryoablation, so freezing cancer cells, and then radiofrequency ablation, which would be heating cancer cells. So treatments for more advanced or recurrent renal cell carcinoma would be surgery to remove as much of the affected kidney as possible. So if they already have not done a full nephrectomy, they may do a full nephrectomy or remove more of a kidney. There is targeted therapy, there's immunotherapy, radiation therapy, and clinical trials. The risk factors associated with renal cell carcinoma. Hypertension is the one I chose, but there's several others. So we have smoking, misuse of pain medication, over-the-counter medication, and this specific category is usually over an extended period of time. There's obesity, family history of renal cell carcinoma, genetic conditions, so von Hippel-Lindau disease or hereditary papillary renal cell carcinoma, exposure to toxic chemicals, chronic kidney disease. Those 2 I put together because that is when things like in your pathways are blocked, and the toxic chemicals can be called blockages. Chronic kidney disease is another instance when pathways can be blocked, which would cause a buildup of the metastatic tumors. And then we have chronic hepatitis C infection, and then any type of prior radiation in the abdomen area can, if they hit the kidneys, they can affect it as well. So for the association of hypertension and renal cell carcinoma, I chose 5 articles, well range of countries, China, Europe mainly, which was those high incidence rates, prospective, case, and case control cohort for the study designs I used, had a wide range of sample sizes, and relatively speaking, all of my estimates were about the same, or it further showed the association of hypertension with renal cell carcinoma. Some confounders I found that were pretty common were smoking status, BMI, alcohol intake, sex, so being male, and then some least common ones would be blood pressure, obesity, waist circumference, VHL genes, diuretics. So for my conclusion, I said that the association between hypertension and renal cell carcinoma has been relatively consistent among all the chosen sources. I used a variety of study designs and statistical tests to analyze the association between the 2, and other sources that I found used, different statistical tests than I suggested or different study designs, but the 5 I chose seem to be most significant with the requirements. So my overall conclusion is those with elevated levels of hypertension have a higher chance of having renal cell carcinoma when they reach the peak age range. Like I mentioned previously, if you have other risk factors, maybe some of this stuff is genetic, then you could, get this disease well before the peak age range. Then these are my references. It includes the 5 references for the association and also includes some other references I used to get some of my data. So thank you all so much. I really appreciate it, and I look forward to hearing your comments.